It's a complex 6-hour surgery that involves organ removal, skin grafts, and the meticulous construction of entirely new anatomy. By the end, the patient's body will be entirely reshaped. To outsiders, the process can seem overwhelming, but for the patient, this isn't just elective, it's life-changing. So what actually happens during gender-affirming procedures? Find out on this episode of the Infographics Show what sex change surgery does to your body. And don't forget to hit subscribe, there's more where this came from. Despite what some might assume, sex change surgery isn't something done on impulse. It's a deeply personal, permanent transformation, and one that doctors don't take lightly. Those who seek it out are usually suffering with an intense form of gender dysphoria, the feeling that they were born in the wrong body. For over a century, doctors have refined procedures to help transgender people achieve the closest possible match to the body they feel they were meant to have. And it doesn't start with surgery. The vast majority of trans people are adults or post-pubescent teenagers who realize their identity after having time to mature. But in the case of those who realize they're transgender very young, the first step, and usually the only step taken while they're underage, is to begin taking puberty blockers. These are hormone suppressors that prevent the formation of the sex hormones that kick off puberty. This is usually done early before the awkward teen years that we all know too well, because those years can provide some unwelcome physical changes even for cisgender people. For those born female, the teen years often make the body become more shapely and include breast development, making it harder to maintain a gender-neutral appearance. But for those assigned male at birth, the changes are even more dramatic. A deepening voice, broader shoulders, and early signs of facial hair. These can make it very difficult for someone who identifies as a girl to pass. It's easier to prevent these changes than it is to reverse them. For most trans people, the next step is to begin replacing what their body isn't naturally producing with something that brings them closer to who they are. That's where hormone replacement therapy comes in. This non-invasive treatment works to either reverse the effects of puberty or stimulate the one their identified gender would have gone through. While this is a non-surgical procedure, the effects can be dramatic. The hormone supplements are typically delivered by pills, gels, patches, or even injections. Many trans people have been on hormone supplements for years or even decades and are completely unrecognizable from their pre-transition self. And there's a different package for each gender. The primary hormone for aiding female to male transition is testosterone, which occurs naturally in those born male. This is often packaged with GnRH analogs that simulate the hormones released by the gonads. The result of these can limit or stop breast development and stop menstruation. These hormones are also used by cisgender men who want to gain muscle, so many trans men taking these hormones get into bodybuilding. The cosmetic changes and boost in strength often have a dramatic effect that makes social transition easy to pull off without surgery. And the results can be equally dramatic on the other side of the fence. Trans women typically take estrogen as the primary hormone in HRT, accompanied by anti-androgens, progestogens, or GnRH modulators. These are usually combined into a single pill like estradiol, streamlining the process. While the effects can be dramatic, leading to breast growth and the slowing and thinning of facial hair growth, but not everything changes. The voice, for instance, is one thing estrogen can't alter. But it's not all smooth sailing. These medications affect the body chemistry, and that can have unexpected side effects. People who go on hormone replacement therapy are essentially putting themselves through a new puberty, with all that it entails. Outbreaks of acne, pain due to the body changing suddenly, and unpredictable voice changes can happen. Additionally, the hormones can affect fertility, reducing sperm count dramatically in those born male. But this is usually planned for. While some trans people prefer to maintain their initial plumbing, the majority report dysphoria surrounding it. And for many trans people, the miracle of hormone replacement is enough. For those most interested in social transition, a course of hormone replacement therapy and continued maintenance is often enough to allow them to pass in everyday life. This is especially common for those who spend most of their time among the LGBTQ community, where being transgender is more normalized, and they feel more comfortable explaining their identity and where they are in their transition. Hormone replacement therapy is easier to begin and only requires meetings with a doctor who specializes in it and a monthly prescription. For someone whose dysphoria relates more to how they're perceived, that's a good solution. But for others, a much longer journey is just starting. For those who opt for surgery, the first step is usually top surgery. This is the nickname for the surgeries that primarily affect the chest, and that's not exclusive to trans patients. In fact, Many of the surgical techniques were originally honed in breast cancer treatment, not gender transition. Removing breast tissue and reshaping the chest is a well-established medical routine at this point, but that doesn't mean it's an easy one. This is a major surgical procedure with a lengthy recovery period that requires careful sanitation, regular maintenance, and ongoing medical checkups. At this stage, patients typically undergo thorough evaluations from their doctor and any specialists involved in the procedure. They'll undergo counseling and ensure that they're truly serious about wanting to commit to this part of the surgical transition, and that they're in a place in life where they'll have the care and support they need. Because this is the first step of the process that is truly permanent. The good news for trans women is that while the hormone replacement therapy part of the process isn't as smooth for them as it is for trans men, they usually skip this stage. Both men and women have natural breast tissue, and hormone replacement therapy causes natural breast growth in trans women. That means that they're going to be bra shopping without ever seeing a surgeon, although the size and speed of the growth can vary. For trans women who want a larger chest after the hormones have their way, breast implants are a possibility, and they can usually do this through a standard plastic surgeon. But for the guys, buckle up. Gender-affirming chest reconstruction is the most commonly performed surgical procedure when it comes to transgender healthcare, and it has several steps. The first resembles the mastectomy performed on breast cancer patients, although here the doctor doesn't have to be careful to remove all the cancerous tissue. Tissue from the inside of the breast is removed, as well as extra skin, and then the chest is contoured, ensuring a smooth healing process and ensuring the right position for the nipples and the areola. Some trans men choose to skip the nipple replacement stage of the process, instead going for a flat chest look, or even getting tattoos that resemble nipples. This can cut down on the complexity of the procedure. But it's not over when they get off the operating table. Top surgery is a common procedure, but healing can be an extended process. The most common method, double incision, involves incisions above and below the breast mass. Grafting nipples on has a risk of rejection, so preventing infection is the top priority for doctors. Aftercare for top surgery involves frequent wound care. This is why in recent years some doctors have begun using what's known as keyhole surgery, which uses a smaller incision to reduce smaller breasts. This has a much faster recovery rate, but it doesn't achieve the same dramatic effect immediately. The combination of hormone replacement therapy and top surgery or augmentation is usually enough to allow people to present as the gender they identify as in social situations. It can sometimes be supplemented by cosmetic procedures to affect the face, providing a rounder appearance or a stronger jawline. This can range from outpatient injections to surgeries that involve bone grafts. These are often done with a plastic surgery specialist who knows how to reshape the face. But for many, they're more concerned with something a lot lower down there. While bottom surgery gets most of the attention from the media, it's actually the rarest gender-affirming procedure. That's because it's a complex procedure and not undertaken easily. While there is no way to actually replace a person's reproductive system, it's impossible to transplant a womb or testicles. Doctors have developed methods to simulate the appearance and, in some cases, the function of genitalia for trans people. This is usually coupled with another major part of the process, sterilization, as the vast majority of bottom surgeries involve removing what was already there. And these surgeries have been happening for a lot longer than most people know. Bottom surgery for trans women is typically called vaginoplasty, and trans men undergo phalloplasty. Both procedures were first performed on transgender people close to 100 years ago. The first reported case of a trans woman undergoing the surgery was in 1931, and the first trans man to have a phalloplasty went under the knife in 1946. But these surgeries weren't pioneered for the trans community. Vaginoplasty was initially developed to reconstruct the genitalia of those born with birth defects that affected the area. Phalloplasty was a surgical procedure developed to help those who lost their penis to an injury, often from a bullet in wartime. But as long as it's been around, it's still a tricky procedure. The process of phalloplasty is usually the easier of the two, although it's still an extensive process. These procedures are done under the supervision of a urologist because that area surrounding the genitalia is highly sensitive. It affects sexual function, reproduction, and excretion, and the resculpting of the flesh around this area has significant risks. For trans men, the process of sterilization often comes before this stage. Some choose to have a full hysterectomy, while others go for a simpler process of tube tying. And then it comes to the construction process, and that skin has to come from somewhere. Phalloplasty typically takes a flap of skin from somewhere on the body, most commonly the arm or leg, and then it's shaped into a cylindrical phallus shape and attached to the clitoral tissue at the base. The nerves from the flap might connect to the tissue, increasing sensation in the new penis. This is largely a cosmetic procedure as the penis is not functional on its own, but the urologist is able to create a urinary canal in the phallus, allowing urination through the new body and opening up the whole new world of urinals. But there's one more stage of the process, and it's a big one. For those who want to get an erection with their new phallus, a penile implant is typically used, either a semi-rigid one or an inflatable one that's filled with a sterile saline solution. This forms the shaft of the phallus tissue and it allows a trans man to have sex normally with the help of a penis pump. Earlier implants have caused complications because they were designed for cisgender male anatomies. However, newer models have since been developed specifically for post-phalloplasty use, making for a smoother process. But while phalloplasty is complicated, it's nothing compared to its counterpart. Vaginoplasty is the trickier of the two procedures because it's typically more invasive, creating a vaginal canal that's used for urinating and for sexual intercourse. The process typically begins with the removal of the testicles, which is often done as a separate surgical procedure, and from there the penis typically isn't actually removed. It's used as the foundation for the new vaginal canal. This is called penile inversion, and it's done by cutting the skin to create an appropriate-sized flap after the scrotum is removed. This is currently the predominant technique, as, well, the alternatives can get a lot trickier. An earlier method, called bowel vaginoplasty, uses part of the colon to construct the neovagina. This offers more flexibility, as the length of the vagina isn't dependent on the length of the penis. However, it comes with a higher risk of infection due to obvious reasons. It does have advantages, though. The new vagina is self-lubricating and it doesn't require as much maintenance and dilation once the surgical area is healed. A newer technique, peritoneal vaginoplasty, uses the skin that lines the abdominal cavity. While this is more invasive, it is promising for those who started puberty blockers early, and as such, growth of their penis was stunted. And no matter what version was used, recovery can be tough. Due to the sensitive location of bottom surgery, post-surgical care requires a lot of attention. The surgically treated area is vulnerable to infection, and excretion can be tricky while the body heals. Preparing for this procedure is usually a multi-year affair, with extensive counseling and medical supervision to ensure there are minimal risks. But despite the difficulties, there's usually a long waiting list for the procedure, going for several months to well over a year depending on the accessibility in your region. Now, if it sounds imposing, it is, which is why those who take this step have usually been struggling with intense dysphoria for most of their lives. It means this extensive and challenging procedure is the best of all options to live the life they want. Want to know more about the equipment these surgeries were meant to replicate? Check out 15 weird facts about the penis, or watch Why Do Women Get Wet for details on one of the more awkward parts of the female anatomy.